Hello, my name is Dr. Andrew Sulich. I'm a board-certified rheumatologist with a private practice in the metropolitan Detroit area. I'm also on staff at Olkin University William Beaumont School of Medicine. As rheumatologists, we typically see patients across a continuum of pain at all stages of osteoarthritis, or OA. Patient may present with stiffness, and their pain can range from very subtle to severe. There is a range of treatment options we can consider for OA pain, including non-pharmacological therapies, over-the-counter analgesics, and prescription medications. The management of OA pain begins with the consideration of non-pharmacological treatment. Physical therapy, rest, and exercise can all play a role in diminishing a patient's pain. In conjunction with these treatments, I consider over-the-counter analgesics an effective first-line pharmacological option because of their availability, relatively low cost, and good safety profile. Over-the-counter nonsteroidal anti-inflammatory drugs, or NSAIDs, and acetaminophen can be effective for reducing intermittent pain, which might contribute to improved function and quality of life for our patients. However, these options have limitations, including the potential for side effects and drug-to-drug interactions. These limitations must be considered and communicated to patients. For example, the use of NSAIDs may exacerbate some coexisting medical conditions and must be carefully considered in patients with hypertension or recent myocardial infarction. In addition, the risk of gastrointestinal bleeding is increased in patients who consume 3 or more alcoholic drinks per day while using an NSAID, and renal insufficiency may occur in patients with kidney disease who take an NSAID. It is important to keep in mind these risks when considering the use of NSAIDs to treat your patient's OA pain. When used as directed, acetaminophen can also be an appropriate analgesic choice because of its safety and efficacy profile. Data have shown that long-term acetaminophen use under the care of a healthcare professional in appropriate OA patients is well tolerated with no related serious adverse events. However, certain patient populations may be at higher risk for severe liver damage when taking acetaminophen, including patients who consume 3 or more alcoholic drinks per day while using acetaminophen and patients who take multiple acetaminophen-containing products. Careful consideration should be given when recommending acetaminophen to patients who have liver disease. Given that patients with OA often have complex medical histories, we must also consider the potential drug-to-drug interactions with any over-the-counter analgesic. For example, when taken with warfarin, acetaminophen can increase the international normalized ratio. The labels for all over-the-counter acetaminophen-containing products direct individuals who take warfarin to consult their healthcare provider before using these products. Before recommending NSAIDs, it's important to consider whether patients are also taking medications such as anticoagulants, steroids, aspirin, and other NSAIDs. When we develop a pain management plan for patients with OA, it's essential to explain why a specific recommendation was made, as well as to review how to appropriately use the product. Patient education can help avoid product misuse and help patients safely achieve relief of their pain. Patients may unreasonably expect a treatment regimen to provide 100% relief of their pain. Reinforcing the benefits of supportive non-pharmacological therapies can reduce a patient's tendency to reach for additional medications if full pain relief is not achieved with pharmacological options alone. In summary, remember that any treatment option for the management of OA pain has limitations. For patients who do not respond to non-pharmacological approaches, start with over-the-counter analgesics and escalate only if necessary and appropriate. To reduce drug-to-drug interactions and to prevent overdose, consider whether your patients may be taking other medications. Finally, educate patients on the appropriate use of the recommended analgesic.